All right. Good evening, everyone, and welcome to ATP Live Monday. I'm Bimisola Boyde. I'm a pediatrician, and I'm going to be the anchor for today. Just let me know you are there, whichever platform you are joining from, whether you are joining me on our Facebook group, our Facebook page, our YouTube channel, Instagram, whichever platform you are joining us from. I want to specially welcome you to this lovely Monday evening, and thank you so much for finding the time to join us today. So, Ask the Pediatrician's Life is a program where you can ask any questions that you have about the health of your children. We have just about an hour to do that. So feel free to start dropping your questions. And I also want you to do me a favor to invite your friends and family, everyone that you know may have a question for the pediatrician. Please invite them to join us now, and then we will try and see how many questions we can answer before it's a 7 p.m. Nigerian time. So thank you so much, everyone, for joining me. So what I'm going to do now is to crave your indulgence while I try and share the videos to all our platforms, make sure I pin it there and making sure that everyone can see me and that they can hear me. And after that, we can start. But you can start to drop your questions, irrespective of where you are. Just drop your questions now, and then we will try and answer them as soon as we can. So thank you so much for joining me. Welcome to ATP Live. Start dropping your questions, whichever, wherever you're watching from. So, for those of you who are watching on our Facebook page, or you're watching on our Facebook group, you can just drop your questions there, and uh, we'll definitely see you. For those of you who are watching, if on the other groups, you will need to click on the video so that you can see you. All right. So let me I just want to change to my profile. Okay. All right. Good. And if you're dropping your question, remember to always start with the age of your child. That is the most important information for a pediatrician. We always need to know the age of the child. So don't just say my baby, my baby. Many of you always do that. Please, the pediatricians will see children in all age categories from 0 to 18 years. So we uh, really need to know your child's age, because the answer to certain questions will vary depending on the age of the child. So please start with the age of the child. Try and be very specific with your questions. Please don't just um, give us information and leave it hanging. We always need to know, what do you want us to do with that information. So try and do that. If you want to ask us about your child's weight, your child is losing weight, all those kind of questions, please, we need to know the weight of the child now and previously, because we rely on objective information for us to answer questions. So please try and help us with that. And which other thing? All right. So and please stay tuned. Don't ask a question and disappear, because some of you will come back and say, "Oh, I asked question, you didn't answer my question." I may have answered your question when you were busy doing something else. So try and stay with us till the end. However, if you leave, you can always watch the video because all those questions will be there. You can always watch the video again, and then you will be able to see your answers. So no problem with that in case you have an emergency and you have to leave. So I think those are my housekeeping announcements, and then I'm just pinning the videos to all the other groups, and then we can start. Welcome, welcome, welcome. And just to also remind you that if you still have questions after the live section, you can always go to our Facebook groups. Our Facebook groups are there, and you can ask your questions from Mondays to Saturdays, and there'll be somebody there to answer your questions. We try to do it within, we say just give us up to 72 hours, but most of the time we actually answer those questions within 24 to 48 hours. So um, try and don't be worried if you can't get your question answered live. You can always post it on our Facebook group. All right. Okay, I think I've been all the videos, I hope. And I think everybody can see me now and can hear me. I can see questions already coming on our Instagram. So if you are on Ask the Pediatrician Facebook group, you can just drop your questions straight away. That is fine. But if you are on ATP Family or any of the other Facebook group, you have to click on the video to be able to see to be able to ask your questions. And then yeah, okay. And it's YouTube, Instagram, you can just drop your question wherever you are. I guess we are good to go. All right. All right. So I think I will start with Instagram people because they're always the first to ask questions. All right. So let's start with Instagram. Thank you so much, all of you who are watching, all of you who have joined us. Good evening, Fifi Ifiam. Good evening, live from IG. Thank you so much for joining us. Mercy Beauty, all of you are there. I think the names are so many. Let me not waste time doing all that. But I want to especially welcome all of you. Thank you so much for joining us. We appreciate you because if you are not there, there'll be no program. So thank you for joining us. So let's start with the first question on Instagram. Fifi Efiam. My question today is I'm a first time mom. Congratulations. I feel like ringing the bell for first time moms. My little princess just turned 1 year old, all right, and would like to know the right drug to give her for deworming. Okay. Yes, you can deworm your child from age of 1 year and you can use any deworming drug. So you just walk into any pharmacy, ask them for deworming medication. It's over the counter drugs. They will give you. We have albendazole. There are many brands of the same albendazole. We also have what we call piperacin. There are many brands like Combatrin and all that. So there are many drugs you can use. Just ask any for any in your pharmacy and they will give you, and just give the dose according to the age of your baby. It's always written on it as well. So there's no problem with that. If you want to use albendazole for a 1 year old, it's 200 milligram, which can be like 10 mils of the liquid, or if it's a tablet, make sure it's a 200 milligram tablet. And you can deworm every 6 months. Not 3 months. Many mothers always do 3 months, but 6 months is what we recommend, and WHO recommends that. Jasmine accessory. My son is 1 year, 9 months. I noticed 3 ringworm spots. Have used antifungal cream for 2 weeks and it's not gone yet. Please, what else can I do? So I will recommend you see a doctor first. Okay. We need to be sure, number one, that your baby has ringworm. I want to trust that you are sure, but sometimes, you may not be correct. That's number one. Number two, the treatment itself. Some fungal infection requires oral drugs, not just the cream. We may need to give the child the one that the child has to take by mouth, and that has to be prescribed by a doctor. So I recommend that you see a doctor. That is number one, so that they can be sure of the right prescription, the right dosage, and all that. So there are some other little tidbits here and there that the doctor may be able to provide information on. And number one, to be sure it's actually ringworm, because there are so many other skin conditions children can have that are not ringworm. And number two, to be able to make sure you're getting the right medication for the right dose and all that. So just see your doctors and then they will take it up from there. All right. Fifi FMC, I also want to know if I can give her malaria drug too. Since I've not administered that before, no. The answer is no. You don't just treat a child with drugs just because you've never done it before. So why do you have to treat a child? The child doesn't have malaria. So please do not treat a child with medication because you feel it's something you have to do. No, there's never any need to give a child drugs for what the child does not need. So if the child has malaria, yes, we will treat the child for malaria. If the child doesn't have malaria, you don't need to treat the child. And it is not compulsory. I know that because people live in Nigeria, you may feel, oh, it's like as if everybody must have malaria. That is actually not true. And you don't have to treat any child for with anti-malaria if they don't have malaria. So that is actually in appropriate kind of approach. So just leave the child alone. If the child has malaria symptoms like fever and other symptoms, yes, then you can treat the child. If the child does not have it, then just leave the child alone. All right, Fifi. Thank you so much. Okay, Fifi and Jasmine have gotten the answer to their questions. And I got Mrs. Simon had dropped a question in the question box. She said, my 14-month-old baby is weighing 10 kilo. Is the weight okay? Yes, the weight is perfectly okay. So your child is 1 year, an average 1 year old weighs 10 kg. So there's no need to worry. All right. Thank you, Titilayo Adewale Agede, our first time, first person to drop a comment on Facebook. More grace from a Facebook user. Thank you. Another Facebook user, that is those on our Facebook group. So if you don't give StreamYard the permission to mention your name, I'm only going to see you as a Facebook user. So she said, good evening, ma'am. How can one detect Down syndrome? Okay, in a child after birth. All right, so Down syndrome diagnosis is very easy, but usually it's a doctor that will make that diagnosis. So there's a way children who have Down syndrome, there's a way they look. There are features, what we call features, the way they look that we can use to identify them. All right. So, for example, they have what we call upward slanting of the eyes. They may have flat back of their head. They may have what we call epicanthophosis, like a fold towards the inner part of their eyes. They may have only one. If you look at the palm of the hands, most of us has like three lines, but usually for children on the with Down syndrome, sometimes they may just have one single line that is running across the palm. They tend to be very floppy, like they're very, as if the body is too soft. So like if there's, they're very floppy. We call it hypotonia in medical jargons. So there are other features that we see. Sometimes the hand, one of the finger may be a little bit bent and all that. So there are features that doctors look out for. When we see it, then we felt that, oh, this child looks downish. However, we still need to confirm it. So we actually send the child for a genetic test. We call it karyotype. So they will look into the chromosomes and looking for chromosome 21 in particular. And if they find that there are more than two of them, usually three, or there's a way it look, maybe a part, there's an extra piece of that chromosome 21, then we can confirm, yes, that this child has Down syndrome. So if you want to know more, if you just Google it, I mean, you'll see pictures of children who have Down syndrome. But please don't go around as parents looking at children and saying they have Down syndrome. No, please don't do that. It's doctors that will do that, all right? There are things we look, and sometimes there may be children that look different, and there are thousands of other syndromes apart from Down syndrome. So don't just go around looking at a child, and if the child looks different, and then you say, oh, this child has Down syndrome. No, don't do that. If you think, oh, your child looks different, or you think a child looks different, take the child to a pediatrician and we will look at the child and then we will tell you, yes, we agree with you, the child looks different. Yes, we suspect it's Down syndrome or we suspect another syndrome, and then we will confirm it. Okay, so we have to confirm it. I'm really emphasizing that because I've seen mothers online. There's a time a mother was going around, she was even doing a lot of health education about a particular syndrome. I think it's Edwards syndrome. And she felt, oh, she think her child has Edwards syndrome, blah, blah, blah. And she was saying so many things. And then she was also saying some other things about the child having cerebral palsy and all that. And I was like, no, those two things don't go together. Your child cannot have a syndrome and have cerebral palsy. There are some diagnoses that don't go together. So I was asking her, how did you know your child has Edwards syndrome? Why was it confirmed? And lo and behold, the child has never even had any genetic diagnosis, but just an assumption, or maybe somebody just mentioned it, and this mom is running to town with it and making so much noise about it. And I know you don't do that. The minimum you have to do is a karyotype, and it's a very simple test. They do it even in Nigeria. So go to this lab, go get the test done, and then we can confirm your child has this syndrome or not. So please don't. I know in Nigeria sometimes we don't have all the resources to do some of the genetic testing, or they're so expensive, but ideally we should confirm. But for Down syndrome, sometimes doctors are very almost, because it's very classical. So sometimes we are very sure, but ideally we should confirm it with some genetic testing. All right, let's move on. Amaka Dim, thank you for joining us. Amaka say, how can I help my 8 month old baby overcome breast milk coming out of his nose? Most especially in the morning from 12 a.m. to 4 a.m. No, a child should not be having breast milk coming from the nose. So that is reflux. So I'm assuming that you, and at 8 months old, really reflux should be, it should not be happening so much, because number one, your baby should be on complementary feeding, so your child is also getting some solid now. I'm assuming, because the period you mentioned is middle of the night, so I'm assuming you are breastfeeding your baby lying down. And I'm assuming that most time, maybe if you are not careful, and you understand you're sleeping and you may be sleepy, sometimes you may actually put the breast in the nose and not put it in the mouth, and you think you're breastfeeding. So please, if you are not sure for your own baby with this kind of scenario, I will recommend that you sit up to breastfeed your baby in the middle of the night. Don't breastfeed your baby lying down. Carry the baby up, sit up, and breastfeed. And then when baby has finished breastfeeding, make sure you let baby settle a bit, rub the back and keep baby upright for like 10-15 minutes before you put the baby to sleep again. But I'm almost very certain that this is happening because maybe you actually don't breastfeeding properly, because in an 8 month old, they can have reflux, but it's not a major issue. If it's a newborn baby, yes, they are still very likely to have severe reflux because they are very small and they are only on liquid milk. But your 8 months old should be on complementary feeding, and of course you are still breastfeeding, but make sure you are breastfeeding correctly, and your baby should not really be having so much of reflux like milk coming out from nose. So, and if it is only happening at certain time of the night, which is what is striking in your question, because if your child has real reflux, it will happen throughout the whole day. It won't matter whether your baby, it won't be at 12 midnight, it won't be at any time. It will happen anytime baby has finished breastfeeding. So the fact that it's happening in the middle of the night gives me some information, and it tells me it has to do with your technique, it has to do with the way you breastfeed. And please make sure you're actually not the one putting the breast in the nose, because you can do that when you're sleepy and you are not awake. But ideally, an 8 month old should be able to take the breast through their own mouth by themselves, to be honest. So just make sure you are awake, put on the light, see what is going on, so that you know what is going on. And if baby has finished breastfeeding, keep baby upright and all that. Ideally, most babies will suck and they shouldn't have reflux by this age, because they are really more mature than other. But just watch what you're doing first, and then you can correct whatever you think may be going wrong. All right. Somebody say, well done, Doc. Good, good. God bless you and your colleagues. Amen. Thank you. Somebody say, my 6 weeks old, my baby is 6 weeks old now. My baby is always raising his head backward. Raising his head backward. I'm trying to imagine what that means. So you, I would really love a video or a picture, but if I'm suspecting, what I think you are telling me is that your baby is having what we call neck retraction, like the neck is to the back. If that is the correct, if I'm correct, that is not right. That is not normal. So, but you need to also be sure that, because a 6 week old baby cannot control their neck. So don't, and because sometimes you don't know whether you're talking to the first time mom who may not understand that. So make sure that it is not that you are carrying a baby and the head is flopping backwards, which is normal because at that age they cannot control their neck. So you should support the neck of a 6 weeks old baby. So when you carry them, you use the crook of your arm to support that neck. So that is the case. But if you think your baby is always keeping the neck retracted, that is the actual word we use for it, towards the back like that, as if baby is staring towards the ceiling, then that is a sign of a neurological problem and you need to see a pediatrician. So I don't know which one it is. So if you are still listening, you can just give me an update. Sorry, let me take a sip of my tea. You can give me an update and then you can let me know which one you're referring to, because I'm really, really interested in which one is happening. Is it that the neck is not controlled and baby is throwing it whichever way and it can go anyway, which is normal, or is baby is permanently always keeping the neck towards the back? That is abnormal, and that will worry me as a neurologist per se. All right. Let's continue Facebook, then we'll come back to Instagram. Somebody is asking, I noticed my baby who is a month old today, her tummy rumbles anytime I'm breastfeeding. There's nothing wrong with tummy rumbling, okay? Even adults, your tummy rumbles. It is gas passing through your tummy. So I get this question a lot of the time, and I wonder why people ask that question, because it happens in adults. Even when you are hungry, you will hear your tummy making those noise. So it is gas. There's really nothing to worry about. Yeah. And I want to know how long a breastfeeding session should last. There's no hard and fast rule about how long you should breastfeed for. So most babies will suck until they are okay and they should stop. So, but we expect that usually it should take between anything 5 to 10 minutes. Some babies can go up to 20 minutes. It also depends on how young the baby is. So when babies are still learning to breastfeed as newborn babies, they are not very effective sucker, so they just stay there long at the breast. Sometimes they sleep off, then they start again. But when they are about 3 4 months, they are becoming more experienced at sucking, and they can easily empty the breast within 5 minutes if drain out the whole thing. So they are more effective suckers. So there's no hard and fast rule. The most important thing is that your baby is sucking, your breast is filling, your breast is emptying, and your baby is gaining weight. So those are more important than how many hours or how many minutes your baby stay at the breast. So I don't want you to get bogged down with my baby suck for 10 minutes, my baby suck for 20 minutes, or my baby suck for 5 minutes. No, those are not really what matters. What matters is that if you are breastfeeding, your breast will feel full at the beginning, and you yourself, you can feel it. You will feel, oh, my breast is full. And then when you finish breastfeeding, you will feel your breast is empty. So that's what matters. And remember, it depends on the age of your baby. So very newborn babies are not as effective as the bigger babies. And then the most important thing that the baby is getting enough breast milk is the weight gain. So that is what the pediatrician is looking for. No matter whether we be stuck for 5 minutes or 2 minutes or 10 minutes or 20 minutes, the most important thing for us is that your baby is gaining weight. So if baby is gaining weight, then we know that baby is getting enough breast milk. So that's what matters. I know breastfeeding should be every 2 to 3 hours. Okay, I think we've answered that question. It's on breast milk. I said the formula given to her for the first week of life. You say, okay, so just keep breastfeeding now. Don't give formula again. All right, let's move on. Good evening, Doc. Thank you for all you do for children. God bless you and your entire team. I really celebrate you, man. Thank you, thank you, thank you so much for your kind words. Next question. Hello, ma. Maybe of 28 months is having some reaction on her forehead, and I noticed a little swelling behind the back of her head. I've applied baby tree button for 3 days. It's not drying up. What do I do? Okay, so if your child has skin rashes, which is what I'm suspecting this reaction is, um, the most important thing is to know what is the cause of the rash, or why did what type of rash it is, and what is the cause. Avoid trying to do self-medication, applying things when you are not even sure what it is that you're dealing with. So there are many causes of skin rashes or skin reaction, whatever you see on your child's body. Some of them could be reaction to products like allergy. Some of them could be bacterial infection, some of them could be fungal infection, some of them could be allergic skin condition. So there are many, many kind of uh, rashes, and there are different causes of them. So what most of us do as doctors is that we want to figure out which one it is, number one, and then what is the cause, because that is what's going to tell us what to do. So I don't know why we as mothers always think there's a particular product that is like a fixer. So anytime a child has a rash, you just get out the cream and start applying it. That is not right, because you don't know what is going. You don't know whether it's something that that product is meant to work on. So if you put your that product on, and it's not for the right kind of rash, then you're going to cause more problems sometimes. So I actually say I prefer you don't do anything until you are sure what it is that you're dealing with. So if you're not sure, just leave it alone. So for this kind of baby, your baby is a 2 year old, I would rather suggest, if you want, you can post a picture of the rash on our Facebook group, because sometimes we can see it also, oh, this is a bacteria thing, oh, this is a fungus thing. Or we can say we are not sure ourselves. We still need to ask a question. We need to ask a question like, did you change anything in your product that you're using on the baby? Did you change the soap? Did you change the cream? Did you move to a new place or something? Or is child itching? Is there any fever? So there are questions doctors will ask you that will help them to know what is causing the rash, and then we can now advise you on the right treatment. So alternatively, you want to see a doctor so that they have a look at the rash, and then they can, but I would say just stop whatever product you're using for now until we've seen the rash and we've told you, oh, this is what we think is causing the rash. And what is the swelling at the back of the head? We actually have to see it, we have to feel it before. There are many things that will swollen at the back of the head. I don't want to make assumptions without seeing it and looking at it. The commonest thing that can swell up is usually with lymph nodes and all that, but sometimes we just have to see it to be sure what it is. So that's what I'm going to recommend for now. All right. Okay. Thank you. I'll go back to Instagram. Where did I stop? Okay. Yeah, I know where I stopped now. If you're all right. Yeah. The next person on Instagram from Olola did see what talk by. Good evening, dog. My baby is 15 months, weight is 11 kilos, 2.5 kg from birth. I'm not sure what the question is, but I guess you want to ask whether the weight is okay. Yes, the weight is fine. You don't need to worry. Just keep doing your complementary feeding, keep breastfeeding up to 2 years if you can, and then we can take it up from there. All right. Okay. I think that's all on Instagram. I hope I didn't miss out anybody's question. No, I didn't. All right. So for those of you who are just joining us, welcome to ATP Live Monday. This is a program where you can ask any questions that you like about your children's health issues, and you will get your answers live. I know somebody dropped a question on the group. Sometimes immediately we put our poster up. Some people will drop questions, and unfortunately, we won't be able to see those questions later on. So it's always best you drop your questions live. But let me try and see whether I can remember that question that the person asked. Um, okay, yes. So memory, as asked earlier in the day, Good evening, doc. My child is eating but not gaining weight. I guess she's 1 year, 10 months, and her weight is 8.6. Uh, Mush is 2.4. I'm not sure. This question is not really very clear, but memory, if you are listening, 8.6 kilo for a 1 year old is because you also wrote 12.4. I'm not really so sure which one is which. But usually an average 1 year old should weigh 10 kilos, and an average 2 year old should weigh 12 kilos. So if your baby is closer to 2 years old and it's weighing 8.6, it's a little bit low. Though it's not like we are worried like we need to run. We just need to make sure the child is there's no reason for this poor weight gain. So number one, we need to check the food. It's not just the child is eating. A lot of people always say, "Oh, my child is eating," but we want to know what is child eating, what quantity, what frequency. For example, if you just give your child pap and milk 24/7, that is child is eating, but the child is not eating well because we need the protein, we need the other source, the vitamins, the minerals, the fruits and vegetables. We need all those things to be part of the food. So we need to make sure that the child is actually getting the right quantity, the right quality of food. We also need to make sure the child doesn't have any health issues that can explain the weight loss. So some children, if they have health issues, then no matter what they eat, they won't gain weight. So until we deal with the health issues that the child has. So what I would normally recommend is to see a doctor because we need to go through everything. We need to also check the weight, check the food you are giving the child, make sure the child is eating well. So if we discover it's the food, then we'll give you advice on how to feed the child. If we make sure that you are giving the right food, the right quantity, and the child is not gaining weight, we like this child should be dewormed. We need to make sure that it's not warm somewhere eating all the food that you're giving the child. So a 1 year old, every 6 months, you should start deworming them. And then we need to make sure there's no other health issues. Is there any heart problem? Is there any kidney problem, any liver problem? We know we check off the other organs. So those are the ways by which we figure out why a child is not thriving or not gaining weight appropriately. So that's what I'm going to recommend for memory if she's listening online because she asked a question much earlier in the day. All right. All right. Okay. Thank you, Dr. Grimisela. Okay, I think I've answered that one. Yeah. Amaka, thank you. Okay, there's another question from Sonia. Say, God bless you and your team. Thank you. I noticed my baby has this rash around his mouth, and I've been applying Vaseline, thinking to make it go away, but it's still there. I went to the clinic. Okay, good. And doctor said it is normal, though it's a general doctor, but I'm not satisfied with the treatment he prescribed. But I thought you said the doctor said it's normal. So if something is normal, why does the child need treatment? So I'm kind of confused. So the question is, what treatment did the doctor recommend? And because initially we said the rash is normal, then why is the child prescribe? Why is the doctor prescribing treatment? So I was lost at that point. So we need to see the rash. I need to see the rash, for example, to give a second opinion, which we try not to do anyway, but we definitely need to say it. So if this rash is around the mouth, what kind of rash is it? Like wounds, like mouth sores, or is it just we definitely need to see it. So Sonia, if you are on our Facebook group, just take a picture and post it on our Facebook group, then we can have a look for you. Unfortunately, you cannot put a picture on this platform because we can't see. You can only put comments and all that. So you can put a picture on our Facebook group and then ask that question again. We can have a look for you and we can advise you. So, for example, I don't know whether some children, when they drew saliva, it can give them some kind of rashes because of that drooling and all that. So I don't know, maybe that's why the doctor says it's normal. But if it's like a sore, like a wound, that one is not normal. We need to be sure it's not like a child is having a viral infection or some children have vitamin deficiencies and they come up with what we call angular stomatitis, like some sores around the corner of the mouth. Then sometimes they have vitamin deficiency, or you can actually have mouth sores or rashes associated with other medical conditions. So there are many possibilities. Okay, so is the doctor prescribe amoxicillin? So I'm not quite sure why the doctor is prescribing antibiotics for what is normal. That doesn't there's a disconnect. So if I tell you something is normal, then why am I prescribing antibiotics? So there's a disconnect there. So I don't understand what normal means. So I would recommend I recommend that you post a picture, not sore and wound, just rash. Yeah, we need to know, we need to see the rash. We need to see. The question is if it is not a sore, if it's not a wound and it's just rash, why is the doctor prescribing antibiotics? So that's the question I need to ask myself. Okay, is it a bacterial infection? So um okay, so I can't give you a second opinion unless I see the rash. So unfortunately, that's the only thing I can say for now. All right. Somebody said, "Good evening, doc. My boy of 18 months is not walking yet." Okay, that is delayed. Okay. You've been to general hospital, was directed to physiotherapy. Good. His body was checked and nothing was found. What are they checking for? I don't know what you mean by his body was checked. It's important that when you see doctors, you ask some questions, okay? Um, if you don't know what the doctor is looking for, you will think nothing was found. I don't know what you mean by nothing was found. The fact that the child is not working is something that has been found. So this child has what we call developmental delay. So the question now is, why is this child having this developmental delay? So it is not by checking his body. When that answer is not going to come by looking at his body. The doctor is checking his body. They are doing what we call physical examination. It does not mean they were looking for something. All right, they are just checking what we call the tone and all that. So that is all they're checking. So they are not looking for something to tell you that they find something like the way you meant it, but nothing was found. It is not. It is. How do I explain that to you now? The fact that they've examined your child's body and they depends on what they tell you, but I guess you were expecting that maybe they were going to find maybe swelling or something. No, that's not what we're looking for. So they are just examining the whole body. The fact that your child is not working is enough finding on its own. And the question is, what is causing that? It's in the brain. It is not in the physical part. So it is in the brain we're going to look for it. So it's not something we're going to find on the body. All right. So I don't know whether you saw a pediatrician, but you definitely need to see a pediatrician. So the pediatrician is the one that should have explained to you why your child is having delay, developmental delay. So there are questions we will ask you. What happened during pregnancy? What happened when the baby was born? Did the baby cry? Did the baby was baby sick? Did the baby have infection in the brain? All those kind of questions. Did the baby has any major illness growing up that could make the child, was the child born premature? Those kind of questions are the question we will ask you, and from there we can tell you, oh, the baby was born premature, so we're not surprised that the baby is working late. Oh, or this baby did not cry at birth, so we're not surprised. Oh, or this baby has severe jaundice as a newborn baby. Okay, that is why. Or this baby has severe infection as a baby, maybe at 3 months, at 6 months. That is why. So those are the kind of questions doctors will ask you to explain to you why your child is delayed. And sometimes we still don't know. Okay, so we ask all those questions. Everything is normal. Everything is normal. The baby did cry. Baby did, was not born preterm. Baby didn't have journey. Baby has never been sick. Then the question is, so what test is going on? So we start doing tests to figure out why the child is delayed. So we may want to do a brain scan. We may want to do blood tests. We may want to do other tests, even sometimes we do genetic tests and all that. So there are things that we will try to figure out why this child is having a developmental delay. And there are some things the doctor would have picked up when examining your child that will also give them idea, oh, this developmental delay is just a general or what we call global developmental delay, or oh, this is part of cerebral palsy, or this is part of a Down syndrome child, or this is part of. There are many conditions that can make a child not to walk at 18 months. That's the bottom line. So the work of the pediatrician is to figure out why, and then to determine, is it something we can treat or is it something we cannot treat, or is it something we should worry about long term, or is it something we should not worry about. So there are many factors. So I'm going to recommend that you see a pediatrician, preferably a pediatric neurologist or a developmental pediatrician, preferably in a teaching hospital. So I'm not saying there are not doctors that can manage this in general hospital, but in teaching hospital, we actually run clinics, specialist clinic for this kind of cases. So we have neurology clinic for children who has developmental delay or neurological disorders and stuff like that. So that's what I'm going to um, advise. But the physiotherapy is to make sure your child's body does not become stiff. They exercise your body, the child's body, but the child is still going to work according to what is going on in the brain. All right. So that is so important, because I see a lot of parents go to physiotherapy and they do it for years or months and years, and they are disappointed because maybe the child doesn't still walk on time. I mean, because they thought that it's like a cure for the delay. No, I always say parents, it's always good to know why you are doing what you're doing. Physiotherapy is not the cure for the child walking. The child will walk when the child is ready to walk. But we don't want the child's body, because if you don't use parts of your body, it becomes it will shrivel, it will dry up. Let me put it that way. I'm trying to avoid using medical jargons. So it will not be useful. So, and that is not good, because when the brain is now ready for the child to use that part, if it has become dried up, it has become shriveled, or it has become so stiff and not, then that would be another problem. And then we have to do surgery and all that. We don't want that. So physiotherapy is because ideally your child should have been moving the body. Because they're not moving the body, physiotherapy is to help them move the body. And whatever the physiotherapy is doing, they will advise that you also do it at home as well. So that is the work of physiotherapy, to keep the body movement, to avoid contractions and all that. The brain is what determines when the child will walk. So as the brain matures, develops, yes, then the child will acquire those milestones depending on what is causing the delay in the first place. So some delay are like minor, temporary, then the child catches up. Some it may never happen. It may never happen. So, for example, for children who have very severe cerebral palsy, so all those are the kind of conversation we want to have with parents at the beginning as part of what we're doing. So this is why I always recommend going to like that kind of hospital where specialists do all that. Sometimes our general hospital, they are so busy, they just, it's just like conveyor belt. You just want to quickly move on to the next one. But having this kind of conversation is the most important thing, because the mother really needs to understand what is going on, what we're doing, what to expect, and all that. But sometimes those things happen over time. And please always ask questions before they ask you to go. Oh, doctor, I have a question. And then ask all these questions so that we can explain it to you, and then what's happened next. All right. So, but it's good that you're doing physio, but I think you still need to see the specialist so that they can explain what is going on. From what you've written now, I can't do that because there's not enough information. There's so much information to ask before we can explain that. All right. Somebody said, what can be used to treat ringworm in children? So ringworm is a fungal infection. So it's treated with antifungal drugs. Sometimes we give it as oral drugs. Sometimes we give it as cream. Sometimes we do both together. So I always say don't self-medicate. An antifungal cream, antifungal drugs, they are doctors' prescription only drugs. They are not, I just go and buy it myself and start using it. Number one, how do you know which one is the right one to use? How do you know the right dose? How do you know how long you're supposed to use it for? So there are things that doctors have to do for you. So please see a doctor, and then you can treat the child properly. All right. So if you are worried about money, some of you are always, oh, why do I have to spend so much money paying doctor consultation fees and all that? You can go to the government hospitals. Government hospitals most time they charge you next to nothing for consultation, and they will see, and you will see the specialist, and they will still write the right drugs for you, and then you can go and buy. So you can go to your general hospital and all that. Even your teaching hospitals, most of them they don't charge a lot. So if you don't want to pay so much, but it's still better to see the doctor first. If don't do self medication, because when you run into trouble, you're still going to come back to the doctor. So it's better to start with them instead of going to us when you run into trouble. All right, the next question. Good evening, Doc. My baby is 1 week old and our cord is yet to follow up. That is fine. Some babies' cord may not follow up until 2 weeks. Some may not even follow up until 1 month. Okay. So there's no need for you to worry and all that. It will eventually follow. Don't try to force it out or to detach it by force by fire. Just leave it alone. All right. There's something like granuloma is pointing out. Okay, I always like to see because sometimes parents throw medical jargons around and they don't really mean what they meant. So please send a picture of that to our Facebook group. I'll have a look and I will tell you. But the most important thing is that you just clean the cord with the methylated spirit. If you're using methylated spirit, clean it with methylated spirit. Or if you're using the gel, apply the gel. I don't know, Nigerians, we always do things. Some people will do both the gel and the spirits, everything as if the more the better. No, no, don't mix it. So if don't do gel and spirits, okay? It's either you do the gel or you do the spirit. So if you are doing gel, it is just once a day, one gel in the morning, and that's it. If you are doing spirits, you have to do it several times a day. So you clean now, in 4 hours, you clean again and clean the base of the cord more. Some of you just clean the part that is drying up in front of the clamp. Mm-mm. It is that base, the one near the abdomen itself, the navel stump itself. That is where you really need to clean. We don't want to see any yellowish slough or anything. We want you to keep it clean. I want you to keep it dry, clean and dry. Please don't use hot water. Somebody still posted a picture. I think on Friday I was answering. Is this Friday or Saturday? I was answering that question. I mean, sometimes let me not say what I want to say. But this child has suffered burns, around the navel because people will do what the pediatrician told them not to do. All right, they were using hot water and they won't even do the gentle water. Is a very hot water they applied, and the child suffer burns around that navel area. This is very unnecessary. This is what we call in medical jargon iatrogenic. In other words, you, the parent, you are the one causing the problem for this child. A child that doesn't have any problem, you have caused problem by doing the wrong thing. So please don't apply dry heat, moist heat, hot water. Don't apply kerosene. Don't apply what else people apply? Cow dung powder, dusting powder. Don't. All right, just leave that cord alone. Clean it with methylated spirit or apply gel and leave it open. Don't apply bandage. Don't apply toothpaste. Close up. Don't. I always like to say what you should not do when I'm answering questions because sometimes as I'm answering my own, there are other people around you that are telling you their own, and sometimes you try to combine my own with their own. No, don't. So please, all those other people, experienced mothers, they come with all their myths and things and confuse you. Please just tell them, okay, I've had. You have had, you don't need to do it. All right. Please don't. Just clean it and clean it every 4 hours. Each time you change the diaper, clean the cord with your methylated spirit. Or if you're applying the chlorhexidine gel, cloxy gel, apply it just once a day. And that's all you need to do. Nothing else, nothing else. All right. So if you have posted it on our Facebook group, we will answer it. I usually do all the picture posts, so don't worry, I will get to it later. All right. My boy can stand with anything and move around. But so when you're asking questions, always start with the age of your child. So your boy can stand with anything, can move around, but cannot stand on his own. How do I know whether I'm dealing with a newborn or a 2 year old? You have to put the age because that question needs an age. A classical example of I need the age to answer this question because there's an age I expect a child to be able to stand and move around and not stand on their own. There's a age I expect the child to stand on their own. So if you don't put the age of the child in that question, this question is a classical example of a question we cannot answer without the age of the child. All right. So I always put the age in the question. All right, I'll come back. Okay, I think the person has put the age. It's 18 months. So an 18-month-old should be able to stand. An 18-month should be able to walk. So if an 18-month-old cannot stand, an 18-month-old cannot walk, that is a delayed child. That child needs to see a pediatrician, preferably a pediatric neurologist or a developmental pediatrician, preferably in a tertiary level hospital. So I've answered a question similar. I don't know whether you were online when I was answering that question. Somebody asked a question about 18-month-old not working. The answer I gave to that mom applies to your own child as well. So you need to see us. Sometimes some children are just a little bit slower than normal, but once it's 18 months, we need to check that is the child just being slow or is there something going on here? So usually children work at 1 year. So we give the children grace of 6 months after. So after grace of 6 months, even if you're a slow person, we expect you to have caught up and be working. So if you are not working by 18 months, we are worried there is something going on wrong and we need to fix it or we need to deal with it. So the last person on Facebook, please, you need to see a pediatrician, preferably a pediatric neurologist or developmental pediatrician in a tertiary level hospital or some federal medical center. Even some general hospitals have those kind of tertiary level care. So, but you have to see one and you have to do it fast. All right. Okay. From ski on Instagram. My 2 year old suck his hand while touching his private. Anyway, I can stop him from this. So it's something, it's an habit some children just do, and there is nothing just an habit. So number one, children do some of those habits. It's a comforting thing for them. They comfort themselves, maybe they are suiting, self-suiting and all that. So the best way to do it is to distract them away from that. So give him something else to do with his hands that he can play with. Give him toys, let him play with the toys. So when he's playing with toys or he's playing with you, then the child is unlikely to be sucking a hand and touching the private. There's nothing wrong with children touching their privates. It is a normal thing at that age. All right. So this is the age where children are discovering their body parts. So they touch it the same way they touch their hands and legs, the same way they touch their private. They don't see their privates the way you are seeing it and getting unnecessary worried of and anxious about it. It's just a normal part of the body, just like the legs, hands, and eyes and ears. The way they touch it, that's the same way they touch their privates. I know parents tend to get distressed over that, and or they see it as masturbation. No, that's not what the children are doing. It's just exploration. They're just discovering their bodies. And it's also another opportunity for you to start teaching them sex education or sexuality education, if you like, where you start telling them this is the body part, this is the private part, this is the public part, this part must be covered, nobody should touch you here, and other opportunities, you can use that to teach them. But the best option is distract the child, give them some. Don't make a fuss out of it and start screaming and cry and make the child to feel like they've done something bad or something. No. So just distract them away, give them something else to play with, teach them the other parts and all that. So and you let them know, well, this is a private part. You don't touch this place when you're with other people and all those kind of things. So opportunity to teach your children. So if you go on our Facebook group, we have a lot of resources that we put on understanding normal sexuality development in children and any of these various stages. All right, I think our time is running up. Um, We got 5 more minutes. Please, good evening, Doc. Show me for King. Please, do babies know when they are full? Yes, they do. They know when they're full. Okay, so they can stop sucking when they're full, or they may not stop because they just enjoy the sucking, not because they are not full. All right, just like some of you adults, so you are full, but you just enjoy the food, you keep eating until you're almost vomiting. So babies know when they're full, honestly. Most babies will stop, but we have a few greedy ones who will continue. No, it's part of life. There's nothing wrong with that. All right, Mrs. Unwane, good evening, ma. Please, what causes random pops in a 2.5-year-old child? There's nothing wrong with everybody pops. It's gas coming out. The gas can either come out through the mouth or come out through the anus. There's nothing to worry about. Or do you mean hiccups? Because I really want to be sure, but whichever way, there's nothing wrong with children having bobs, hiccups, and all that. Most of those things last for a few minutes and then you go on their own. So, and especially if your child has been crying and screaming, so the process of crying and screaming, they've taken a lot of gas. Because when a child is crying, when they are screaming, they are sucking in hair. They are taking a lot of hair into their intestine, and they don't need hair in that intestine. So the gas has to come out one way or the other. So it's either they bring it out through the mouth or they bring it out through the anus. It does have to come out, and there's nothing wrong with that. So nothing to worry. So I think you should rather focus on reducing how much of uh, crying and screaming and sucking a lot of hair that the child does. So I think that's the best thing. Oh, okay. So you are the same person. Okay, I guess that's fine. So I just want to be sure. So if your child is already standing and the child is close enough, that's good. At least it's better than a child who is not yet even crawling or sitting and all that. So the child most likely may still be able to walk soon, but we still need to make sure there's nothing else going on that we need to deal with. All right. Okay, I think I've answered all the questions on Instagram and I've answered all the questions on Facebook. And I think for the very first time, I'm really, really working within time. All right, so thank you so much, everyone, for joining us this evening. So, like I said, if you still have questions, you can always post your questions on our Facebook group. So, we have about 4 Facebook groups. Yeah, so Ask the Pediatrician is the most popular one everybody knows. So you can post your children health questions on ATP Ask the Pediatricians, Mondays to Saturdays, 24 hours every day. One of our pediatricians, our doctors, our moderators, they will attend to your question. We are more like a first call kind of service. We don't treat or diagnose your children on Facebook, but we can give you advice. Like if you're in UK, for example, you call 111 if you want to know what to do. Then they will tell you, oh, you have to go to the hospital for this one, or no, this one just go to the pharmacy, or this one just call your GP. That is the kind of service we do, but we do it on social media. We look forward to the day where we can actually do something like on the phone. So that is what we do on our Facebook group for the children. Ask the pediatrician. For the adults, we have the ATP family. So ATP family, you can ask your adult health question, pregnancy question. We have our gynecologists, our family physicians. They'll be able to assist you. We have this FTM for the first time mothers. We have our FTM baby care Facebook group. I know I've not really been very active on that group, but that is where the first time moms can get all the resources. We have lots of resources for first time mothers, digital products that help you to navigate motherhood very smoothly and without worry and fear. You just be a pro. You don't need any omugo. You're our FTM companion. We have the books, we have the videos. They will be your omugo, they will be your FTM companion, and you can navigate motherhood very smoothly. And then we have our ATP Still a Mom Nigeria Facebook group for those who have suffered maybe loss of pregnancy or children, and you just want that um, uh, platform where you can express yourself and get some emotional support. And so it's a very sensitive group. You are welcome to that group as well. So those are the four groups that we operate. And of course, if you want to learn a lot about children health issues, you can go to our website, askthepediatrician.com, www.askthepediatricians.com. We've written on all these topics: milestones, immunization, breastfeeding, all the topics, anemia, skin rashes, heat rashes, all those kind of topics. We have over maybe close to 100 kind of topics on that website. So go there, you can read and learn about it. And for you can also, if you want to listen to my teachings on those topics, some of you like to read, so you can go to our website and read. If you're the type that loves to listen, you can follow my podcast, Ask Dr. Bemi ATP podcast, so you can listen to all those topics as well. Each Thursday I do one teaching. I think last week I talked about I talked about women health issues last week because it was Women's Day. And so please listen to that. For those of you who are mother, that's actually for you. It's not for children, but you should listen to it. Important health issues that affect women. You really need to listen to that podcast. And there are many other topics on my podcast. It's on Spotify, it's on Google Podcasts, it's on Amazon Music. So there are all these podcast platforms. You will definitely just search Ask Dr. Bemi ATP, and you can always listen to those important topics. So those are the avenues by which you can learn. And of course, our YouTube channel, all these videos, ATP Live, ATP Hour, all our teachings, all our programs, you can watch it either on Instagram TV, or you can also watch it on our ATP TV YouTube channel. If you look at the back or any of our platform, you will see the links to all this, and you can always check it out. So thank you so much, everyone, for joining us. I think that's all my announcement for this evening. And I'll see you again on Thursday, where I will be taking another topic. I know it was the World Cleaning Day a couple of weeks ago, days ago, and also the World Hearing Day. So I think I will be doing a teaching on one of those this Thursday and subsequently as well. So, but if you have any particular topic you think you would like me to talk about, feel free to send me a message. You can put it on our Facebook group. You can put it anywhere, DM anywhere, and then I'll try and make sure. Somebody asked me about sepsis the other time, and I did a teaching on sepsis, and I hope the person has listened to it. So you can always make those kind of requests, and we'll try and address them. So thank you so much for joining. Thank you so much for listening. Have a wonderful evening. And if you are just joining, not too late. When I go offline, this program is still going to be there on that platform. You can watch and you can listen again. So it's bye. Bye, everyone. Have a wonderful new week. God bless you. Bye.